The second speaker against the proposition is Lisa Sutherland from Canada.
Thank you. So when I think about U equals U, I think about the possibility of ending stigma, stopping the transmission of HIV, and reducing the psychological impact of the diagnosis. But I also think about the implications of U equals U related to men and to women. And though I see how it applies to women positively, I feel it does not apply to all aspects of women. U equals U provides the opportunity to create normalcy where there was stigma, and yes, science is telling us that U equals U, but the virus is in breast milk, and as long as mom is taking her medication diligently, the risk of transmission is almost zero. Almost. As a community member, I can tell you that the decision to breastfeed or not because of my status was wrought with guilt and the desire to do what feels right versus what is the right thing to do for me. Life gets busy, and moms are often focused on caring for those around them, and at times we forget to take our medication on time or at all. How can we be sure that U equals U applies to breastfeeding? If there's mastitis or enteric issues, how can we be sure that it applies? Before I had my kids, I was pretty sure that I wouldn't be allowed to breastfeed, but I had some hope that if I stuck with my medication and remained undetectable, that maybe there was a chance I could try. Until I saw a mother pump her milk because her nipples were too sore to breastfeed that day, and her pumped milk was almost pink from blood. How can we be sure that the blood wasn't already in the breast milk before she stopped? I'm not speaking about where the argument is between choosing safe drinking water for formula and exclusive breastfeeding. I'm speaking about where there's a safe option for formula versus breastfeeding. I've been undetectable for 10 years, I have 2 negative children, and I did not breastfeed. I made a decision that I could make. I have access to clean water and formula. I did not want to take a chance. And given that medical access and treatment aren't universal, can we really say that U equals U in all aspects of women's life worldwide? I believe that there is a risk, and if I forget to take my medication on time, or at all, there's a risk. The WHO's recommended breastfeeding guidelines apply to low resource settings, and though in some cases the evidence shows no transmission at all, other studies still have a rate above 0.1. The UK guidelines discuss making breastfeeding as safe as possible. If you or your baby experience diarrhea or vomiting, which can be a side effect of medication, this can increase the risk for transmission. Most women experience cracked nipples or thrush or mastitis, increasing the risk of infection. If HIV becomes detectable, you must stop breastfeeding. There's a risk, and until more research is done, it's a difficult decision to make, to take a chance or not. U equals U is both true and not true. It's the beginning of a continued conversation among many things: choice, power, and to be supported to make informed decisions. The research needs to continue to grow related to breastfeeding to better understand the risks related to breast issues, enteric issues, and the risk of vertical transmission. There is virtually no vertical transmission of HIV through pregnancy and delivery, and virtually none through breastfeeding, but it is not zero. The partner studies stated that in almost 180,000 condomless sex acts, there was no transmission of HIV in serodiscordant couples. However, in the research I reviewed, nowhere said that the risk for breastfeeding was zero. It says nearly zero chance of vertical transmission. How do we get to zero? More research still needs to be done to say that U equals U applies to all aspects of women.